Thank you, Mr. Chairman. Commissioner, thanks for being here today. You know, as we have this discussion about how to properly handle a sequester and how to resolve budget reductions that you're facing, it's interesting to note the federal government continues to grow at some pretty significant rates. This year, the federal government will have more tax dollars from the American people than any other time in history, yet we're still running record deficits. And so I think we all know that as you endeavor to try to figure out how to do more with less, and you're getting greater and greater requirements put upon you based upon implementation of the Obama health care bill, new laws passed by Congress, those are additional requirements that your agency didn't have some time ago. That's what the private sector's had to deal with, and so I know you get that, but just in context while we have this debate and think about how we have to handle these reductions, for most of the American people, they've had to deal with much more than this. Folks have lost their jobs. They've had, hours cut, salaries cut. I talked to a constituent yesterday who has having her hours cut because her employer doesn't want to have her have over 30 hours qualify under the health care bill. And so huge problems in the economy, some of which have been created by policies that have been pursued by Congress over the past few years that increase mandates on businesses, increase the cost of doing business. And I want to talk about a couple of particular of those and then have a few questions for you. One of the impacts on the economy have been billions of dollars in unfunded mandates, trillion in taxes on the health care law. We just raised taxes on January 1. And so if those burdens weren't enough, we now have federal food labeling mandates, which I know your agency is engaged in, on our local grocers and convenience store owners. All of this is obviously, of course, bad for the economy. Job creation drives up the cost of doing business. And so I guess I know one of the mandates on the FDA was to try to help those requirements coming from the healthcare law have the most affordable way to be implemented. And so I guess I'd ask, where are we on those food labeling requirements? Are we working hand in hand with our grocers and convenience store owners to ensure that these healthcare mandates that are required by law to come down the pike that you have to create rules for can be done in the most cost beneficial manner as possible? And do we know what the impact is in terms of the outputs that these convenience store and grocery store owners are going to have to pay?
Well, the Healthcare Reform Act did include menu labeling, as you note, for chains of 20 or more, and also for vending machines that when they're 20 or more by the same owner. And we have been doing rulemaking on that, and it has been an extended process with proposed rules, notice and comment, and we are now working through all of the comments that we've gotten in that process to put forward the final rule. One of the challenges of this, to be frank, has been really defining what is a restaurant-like establishment. What a restaurant is seemed very straightforward, and I initially thought that implementing this was going to be, one of the easier tasks before the FDA, but it's been actually enormously complicated. And, some of the issues about convenience stores, box stores, movie theaters, different kinds of facilities that sell prepared food have all been, part of the discussions and considerations. And we've attempted to look at both the public health impact and, of course, the economic analyses required to look at the requirements for implementation, trying not to make an excessively burdensome rule, but one that will have meaning and reflect the spirit of the legislation. So we will be, by the end of the calendar year, I think, putting out the final rule on menu labeling.
Do we know what the cost to comply is? I've seen some reports saying that it would be up to $1 billion on grocers and convenience stores. I've seen reports showing less. Does your agency have an idea of what this will cost these small business owners, and how can the FDA help reduce those costs?
Well, I think there have been various estimates out there as people have sort of thought about different models for how the contours might be defined in terms of the broad array of restaurant-like establishments. The final determinations have not been made in terms of which kinds of facilities will be in and which won't be, but we are looking at economic analyses as well as public health implications with respect to the overall consideration of the appropriate regulatory.
I have one question regarding the PDUFA user fees. When those fees are sequestered, do those fees go back to the paying entities, or are they allowed to be spent at a later date by the FDA? Is this a delay in expenditures, or is it actually a cut? And if it's a cut, do the fees go back to the paying entities?
I think that is a question that is still being resolved at higher levels than I. The user fees are being subject to the same levels of cut in sequester as budget authority dollars. Those fees are still being collected from industry,
right.
But they are not going to support the FDA programs that were negotiated with industry as part of the collection of those user fees. Do you want to speak to?
I guess the only other thing I would have to add is that FDA and the user fees are, with regard to sequestration, follows guidance under OMB, and our understanding is that those dollars are held basically in FDA's account, and the only way that FDA would have the authority to spend them would be if Congress took action to effectively reappropriate them.
So essentially the money's still there. It's not necessarily a cut. It's a delay in spending. The FDA may get those dollars at a later date if Congress gave them permission. And I've got to yield back.
I don't know that for sure, but that would be